back. So Health Minister Dr. Aaron Motsoaledi says the recent decision by the United States to freeze HIV-Aids funding to South Africa should serve as a wake-up call to strengthen systems. He says the virus can only be eliminated as a public health threat by 2030 if more people are on antiretroviral treatment. Newzroom Afrika's Veronica Makhoali has more.
The Health Department has launched the Close the Gap campaign in Soweto. It aims to place an additional 1.1 million HIV-positive people on treatment by the end of the year.
We also know that most of the people who are looking for are men. That's the message which people also must know. We are looking for men because out of this 1.1 million, the majority of those people are men. Women have done very well to help the fight against HIV. I must say, I want to repeat it many times, women must have done very, very well in this battle. When we launched the first program in 2010, after 18 million people were tested, who came to test for HIV-Aids, 65% of them were women. 65% of them were women. The remaining were men and children, but 65% of the people. So in this battle, they've done very well. Not surprising that men are lagging behind, but we know that the transmission goes mostly through men. So we are looking for them.
South Africa has the highest number of infections globally. The country has, however, made good progress in getting people on treatment.
So SANAC has galvanized all the SANACs within all the provinces to make sure that everybody hits the ground running to find the 1.1. The targets have been broken down to meet not just the 2025 targets, but also the 2028 targets for the National Strategic Plan for South Africa by province, by district, and by facility so that it's easier for them to find. Because the facilities know their patients. They know who is missing from care. And if they work with all the stakeholders, including the traditional leaders, the traditional healers, they'll be able to find them and bring them back onto care.
We work with them on the 95 targets across the world. We're making sure that wherever there are losses, we are looking at how to help fill those gaps. Who can we mobilize to help us to figure out what are the gaps that need to be filled? In the case of South Africa, we know that the issue of prevention is a major issue. Today we're launching really the acceleration of work on treatment. But that, we believe, will also be a huge driver to ensure that prevention of those most vulnerable, particularly young girls who are infected mainly by the men, as Minister was saying, will be prevented from new infections. We cannot afford at this time to turn back the tide on the progress we have made.
But the recent halting of aid by the United States has created a 17% shortfall in the Health Department's budget to scale up its HIV response.
Today we're seeing this remarkable will from the South African government that's saying we are not going to slow down just because of decisions made in Washington, D.C. And that is really right. The aid freeze is honestly unconscionable. We've got 20 million people around the world who are supported by U.S. funding to be living with HIV on treatment right now. But we, as UNAIDS, are fairly confident that actually when the United States government takes a look at what is actually being funded, takes a look at the impact that it's having, the funding will be unfrozen, we hope. We think that that's absolutely necessary because, again, we are looking toward 2030 when we're trying to end the AIDS pandemic. And that's not something that's going to be accomplished one country at a time. It's not something that's going to be accomplished one continent at a time. It's truly a global push. And in fact, what the President's Emergency Plan for AIDS Relief has accomplished around the world is remarkable. It is U.S. leadership in many ways. South Africa is showing the kind of leadership we need from all the countries, not just the United States, not just South Africa, but Europe, Latin America, throughout Asia. We think it's possible, and we think that the political will can be found.
The Health Department says while the loss of external funding is a setback, it's also an opportunity to become more self-reliant. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali in Johannesburg.